Welcome to this series of training modules on New Me Clear Aligners, a treatment option to help you provide confident and affordable smiles for your adult patients. This introduction module includes an overview of New Me by Invisalign treatment and explains how you could benefit from offering this teeth straightening solution to your adult patients. Why did we create New Me treatment? With an increasing number of patients requesting teeth straightening treatments, you can now meet these needs by offering New Me Clear Aligners. They provide a dedicated, simple treatment option for dental professionals. New Me treatment is a turnkey solution made by Align Technology, the manufacturer of Invisalign Clear Aligner Therapy. New Me Clear Aligners help your patients and help you grow your practice. Each New Me Clear Aligner is designed to apply forces and achieve the specific tooth movement planned for that stage. Aligners are used sequentially, 2 weeks at a time, to move the patient's teeth in small increments from their original position to their final position. New Me treatment has been specifically designed for treatments involving tooth movements from second premolar to second premolar, mild crowning, mild spacing, pre-restorative anterior alignments, orthodontic relapse, and aesthetic treatments. What are the key features of this treatment option? New Me treatment provides you with several tools to help you identify and treat your patients with optimal efficiency, including a case assessment tool and one-click digital treatment planning using our proprietary New Me ClinCheck Viewer software. The real-time case assessment tool helps you to identify suitable patients for New Me Clear Aligners. After uploading intraoral photos of your patient to our system, you receive an assessment of the case's difficulty level based on the patient's clinical condition and chief concern. In just minutes, you can have the information you need to determine whether to treat the patient with New Me Clear Aligners. Our New Me ClinCheck Viewer software allows you to view the digital treatment plan that is custom designed for your patient. This means simple digital planning and a one-click feature that allows you to approve a treatment plan and bring efficiencies to your workflow. This introduction module presented New Me Clear Aligners, a treatment offered by Align Technology, the manufacturer of Invisalign Clear Aligners. It also describes clinical conditions suitable for New Me treatment, and the module highlights key features such as the New Me Case Assessment Tool and simplified one-click ClinCheck Viewer you will use to approve the treatment plan. Please proceed to the next module and learn about how to get started. Welcome to the doctor site for New Me treatment. In this module, you will learn how to get started with New Me by Invisalign treatment, including how to set up your New Me provider account, how to navigate and use the doctor site, how to create a new patient file, how to use the real-time case assessment function to help you identify potential candidates for New Me treatment, how to submit the initial prescription form, taking impressions, and using the iTero intraoral scanner to send digital scans. When you successfully register for a New Me account, you will need to set up your doctor profile, including your clinical preferences. If you have not completed onboard training for Invisalign Clear Aligners previously, you will see only 2 sections active in the site menu: Support and Education. You will need to complete this entire series of online training modules in order to prescribe New Me treatment for your patients. Once that's completed, you will be able to access the patient, account, and payment sections and the online store. When you first log on to your New Me account, you will be prompted to change your temporary password. Please also make sure your account billing and shipping address are accurate. Once you are trained in New Me by Invisalign treatment and become an active provider, all 6 tabs will be visible in the interface. This includes 1. The Patient tab. Here, you will create a new patient file or access any information for your existing patients receiving New Me treatment. 2. The Account tab. which shows all your account information, including your doctor profile and shipment information to date. Third is the Payment tab. View all payment information and access the new online payment system to ease your payment process. Education tab is number 4. Access instructional resources to support your use of NuMe clear aligners. The Store tab allows you to order all the relevant dental supplies for prescribing NuMe treatment. Lastly, the Support tab provides you with information including your contract, pricing, terms and conditions, and customer support information. In order to create a new patient file, first click the Patient tab. Input the required data fields for your patient, select a shipping option, and click Next. Now decide which course of action is best for your patient. For assistance in determining if your patient is a candidate for NuMe by Invisalign treatment, select the Case Assessment procedure and advance down that path. If you already know his or her clinical condition is appropriate for NuMe treatment, simply click the Start Prescription button to begin the prescription by skipping Case Assessment. Original photos should be used with the Case Assessment tool, uploaded without modification. You will be able to adjust your photos once they are uploaded to the site. To upload photos, left-click anywhere on a placeholder image. A dialog box will appear. Navigate to the folder on your computer where you keep the patient's photos. Select the photo that corresponds to the placeholder image. Once selected, click on the Open button. Alternatively, you can double-click on the photo you want to upload. The photo you selected should now be visible on screen. Repeat these steps for the remaining photos. Each photo must be at least 2 megabytes in size and not exceed a maximum of 10 megabytes. To adjust or delete a photo you have uploaded, click on the Edit link below the photo. The following options are available: vertical flip, horizontal flip, rotate left, rotate right, crop, and delete. Once all patients' photos have been uploaded, click the Next button in the lower right corner of the page to continue. The next steps are easy to follow. First, select the clinical condition that best represents the patient's chief concern. Then click Submit. Approximately 5 to 10 minutes after successful case assessment submission, check back on the doctor site for NuMe treatment to view the outcome of case assessment. You will receive an email notification to inform you that the case assessment result is available. A case assessment like this green outcome indicates that your patient's chief concern can be addressed by NuMe clear aligners. This confirmation shows that NuMe treatment is appropriate based on the assessment, and you, as the doctor, can make your treatment recommendation accordingly. Simply click Continue to fill out the prescription form. A yellow outcome indicates the patient's chief concern may not be fully addressed by NuMe clear aligners, and you have 2 options here. 1. Proceed with the prescription form and receive a treatment plan for partial treatment. If you decide to move forward with submission, click Continue. Or, alternatively, 2. Decide not to continue with the submission. If this is the case, you should encourage the patient to register their interest on the Invisalign website at www.invisalign.com. Our friendly concierge representative will work directly with the patient to locate a suitable Invisalign treatment provider for further consultation. To fill out the prescription form, start by indicating which arch will be managed with NuMe treatment. In most cases, both the maxillary and mandibular arches should be treated. Select the patient's chief concern and then click Next to proceed. In Step 3, indicate if there is any tooth that should not be moved. Bridges and implants, for example, can be marked using your cursor if necessary. Then click Next to advance. In the prescription, you can also customize appropriate spacing for your patient. Simply click on the Edit link to designate. Both PVS impressions and Align-approved intraoral digital scans are accepted for the patient's dental records. Please select the method you will use and then click Next. If you need any replacement impression trays, please indicate here for the upper and/or the lower arch and the size of the impression trays. If you conduct a case assessment, the patient's photos will be automatically populated on this page. If you skip case assessment, you will now have to upload the patient's photos to the doctor site. Start by left-clicking anywhere on a placeholder image. A dialog box will appear. Navigate to the folder on your computer where you keep the patient's photos. Select the photo that corresponds to the placeholder image. Once selected, click on the Open button. Alternatively, you can double-click on the photo you want to upload. The photo you selected should now be visible on screen. Repeat these steps for the remaining photos. To adjust or delete a photo you have uploaded, click on the Edit link below the photo. The following options are available: vertical flip, horizontal flip, rotate left, rotate right, crop, and delete. Once all patients' photos have been uploaded, click the Next button in the lower right corner of the page to continue. Note, this photo upload must be completed from your computer on DoctorSite for new Me treatment. Lastly, the prescription summary form is presented, so you can confirm all the details are accurate and ready for submission to Align. As necessary, you can change any item listed. Once the submission information is in order, click Submit. Once the prescription has been submitted, you will be presented with links to print a shipping page and a mailing label. Print the shipping page and mailing label by clicking on each link. Clicking on each link will open a PDF of the document in a new browser window or tab. Print this PDF and return to the confirmation page. After the required pages have been printed, click on Done to complete your submission. You will be directed back to the patient file page. When you're ready to ship the patient's PVS impressions, place the shipping page in the box with the PVS impressions and affix the mailing label to the outside of the box. If you used an Align-supported intraoral scanner for digital impressions, your patient's records will be automatically sent to Align Technology with your submission. You will receive an order confirmation to verify successful submission of your prescription and new Me treatment order. At any time when you navigate this doctor site, simply click a Patient tab to view all activities associated with the patient. Click through to complete the required action. If any clinical issues are detected with your prescription, you will receive an email notification from New Me Customer Advocacy outlining next steps to update your submission. For quality full arch impressions, you need PVS putty, PVS light body wash, and impression trays, each used according to their manufacturer's instructions. Additional information on impression techniques can be found on the doctor site for New Me treatment. Use only PVS impression material approved for PVS impressions, and be sure to wear vinyl, nitrile, or powder-free latex gloves. Using equal amounts of putty, set the timer and mix. The putty is ready when it is uniform in color, without swirls. Roll the material into a hot dog shape and load it into the impression tray. Press the putty against the tray, locking it into perforations. Use your fingers to create a trough by pre-shaping or dimpling the putty to the arch shape, and build up the putty at the distal portion of the tray to contain the light wash and to capture terminal molars. Place the tip of the light wash against the putty and release the material into the tray. Firmly press the tip into the light wash material to prevent bubbles. Dry the patient's teeth, then insert the tray straight and evenly into the mouth, centering the tab to the patient's nose. Be sure you do not rock the tray. Use a timer and follow the recommended setting time. When the manufacturer's recommended amount of time has passed, do a fingernail test on the impression material to make certain it is set, since PVS setting times can vary. After confirming that the material has set, remove the impression tray using a back-to-front motion, allowing the posterior seal to be broken first. Inspect the impression for defects. Look for defects such as air bubbles, double impression, missing anatomy, push-through, blended tooth, and gingiva. Retake any impressions that contain these defects. Once the impression has passed inspection, repeat the procedure for the opposing arch. Disinfect the impressions and place them in a submission box for shipping. Nu-Me Clear Aligner Therapy and iTero intraoral scanners are a natural fit if you are using or consider adopting digital intraoral scanning in your practice. iTero scanners are highly accurate and have been used in more than 1 million orthodontic scans. iTero scanners capture more than 6,000 frames per second, enabling fast, efficient scanning of your patients using a lightweight wand and intuitive touchscreen display. To submit patient records via your iTero scanner, simply select Intraoral Scans and follow the on-screen prompts. You may also use the doctor site to submit a replacement prescription. Start by indicating which arch or arches are needed and then indicate the stages to address in the replacement prescription. To submit your replacement prescription to Align, click the OK button. You will note this submission in the patient file where you can continue to monitor status. Congratulations! You have just completed Training Module 1 for Nu-Me treatment. Please proceed to the next module and learn about how to view and approve a Nu-Me treatment plan. In this module, you will learn how to review a digital treatment plan for Nu-Me treatment and how to approve it. The next phase of treatment starts once Align Technology has received a patient record and prescription form from you. When the patient's treatment plan is available, you will receive an email notification informing you that the treatment plan is ready for review. Log on to the Nu-Me doctor site. Under the Patient section, you will see Action Required to View Treatment Plan. Depending on the criteria of the case, the treatment plan also indicates the number of stages or trays required and the corresponding lab fee. Click the button to proceed. When a patient's treatment plan is available for your review, the patient status on the patient page will change to Review Treatment Plan. Click on the patient to get to the patient's patient file page. On the patient file page, select the View Treatment Plan button to view the patient's treatment plan. In the treatment plan, the patient's proposed treatment plan is displayed as a 3D model. Also visible in the sidebar are comments offered by Align technicians for the proposed treatment. Using the stage bar at the bottom of the viewer, you can view and compare the initial and final positions on the patient's simulated treatment and any other treatment stage between them. Starting at screen left, the first button allows you to show or hide tooth numbering. Right in the middle of the buttons is a control that allows you to jump directly to the maxillary occlusal view of the model. The last button at screen right calls up the mandibular occlusal view of the model. To zoom in or out on the model, use the plus and minus buttons on the left side of the viewer. To reset the position and size of the model, click on any of the view buttons. You can also interact with the 3D model by clicking anywhere on the 3D model and dragging in the desired direction. Once you are satisfied with the treatment plan, select the Approve button. Be sure to review all comments before you approve the patient's treatment plan. Once you approve the treatment plan, Align will begin the manufacturing process for your patient's custom aligners. Once your treatment plan is approved, you will see this order confirmation page. At this point, you will need to review your order details and confirm. The Nu-Me clear aligners, together with the patient starter kit, will be delivered straight to the doctor's office. Keep in mind that inventorying the following items is very important: aligners and doctor's instructions for use, patient starter kit, which includes a 2-aligner storage case and patient's instructions for use, the treatment overview, treatment views, and clinical comments. Before the first appointment, review the treatment plan page from the patient's Nu-Me treatment kit. Make sure to monitor your patients every 4 to 6 weeks to ensure that the patient is following your prescribed treatment and the aligners are tracking well as per planned movement. At the first appointment, make sure to review the use and care instructions with the patient in order to ensure proper use and avoid damage to the Nu-Me aligners. It is important to confirm that the patient can properly insert and remove the aligners. Review care and maintenance of the aligners and discuss the importance of proper oral hygiene during the aligner treatment. Also, make sure to review proper aligner storage instructions and emphasize that the recommended wear time is 20 to 22 hours per day. At every appointment, check the fit of the current aligners. Use unwaxed dental floss to determine if any contacts are tight and in need of adjustment. Ask the patient to insert the new set of aligners and test their fit. If the aligners aren't fitting, review the education section on NewMe website for further instruction. If you need to order a refinement, you can contact dedicated customer support for NewMe treatment. For each NewMe treatment, you can order one refinement, which includes up to 3 stages. Congratulations! You have completed the NewMe by Invisalign Treatment online training module. Please proceed to the doctor site and complete the displayed quiz and survey questions in order to receive your certificate of course completion. Thank you. We hope you will find providing NewMe treatment beneficial to your adult patients and your practice. We wish you all the best.